Hi, I'm Hussein Musa, one of the GPs in Blackburn and also one of the medical examiners at Royal Blackburn Hospital. This is Darren and Andy. Do you want to introduce yourselves?
Yeah, I'm Andy Sloan. I'm a consultant trauma and orthopaedic surgeon, but I'm also the lead medical examiner based at ELHT.
And I'm Darren, one of the medical examiner officers based at ELHT, or hosted at ELHT.
So Andy, tell us a little bit about the medical examiner service.
So the ME service was set up on the background of three national inquiries really, the Mid-Staffs Inquiry, the Morecambe Bay Inquiry and the Shipman Inquiry. And the idea is to give greater scrutiny to deaths that aren't referred to the coroner. There's been a service in trial running in the country for a little while, and then in 2019 at the back end we in East Lancs were asked to set something up to start scrutinising the deaths in the acute trust, and I was appointed to lead medical examiner at that time.
Thanks Andy. So tell us a little bit about the purpose of a medical examiner.
So the medical examiner in the service has a few roles. One is to provide a proportionate review of that death and scrutinise that death by linking in with the clinician and having a review of the medical records. The second one is to ensure that there's accuracy around the information that will go down on the medical certificate cause of death, the MCCD. And then probably most importantly really is to put the family and the bereaved at the centre of the service. So we will speak and liaise with the family, explain to them the information that's been proposed on the medical certificate cause of death, and also ask if they've got any concerns or any questions. And a lot of those concerns and questions can actually be answered and resolved at the medical examiner level.
So it's currently October 22. Where are we up to locally then with the ME service?
Yeah, we've done a lot of work over the last 3 years really. We're now, and have been for 2 years, reviewing all deaths in hospital. And then over the last 6 to 9 months we've expanded the ME service quite significantly as we were instructed by NHS England to roll out to non-acute deaths, to community deaths. So currently we're reviewing deaths from 2 of the peripheral hospitals, Clitheroe and Pendle. We're reviewing deaths from 2 hospices, and we have started the rollout to community deaths and GP deaths. And the aim is to expand that over the next 3 or 4 months so that we're in place by April 2023 to be reviewing all community deaths as well as hospital deaths, because the law will be passed hopefully around 2023 April for it to be statute that all deaths have to be reviewed by an ME service.
So Darren, you're one of the medical examiner officers. Could you tell us what that means and what the makeup of the rest of the service is?
Yeah, medical examiner's officer. We're a supportive role for the service, hosted at ELHT Trust. There's 5 medical examiner officers. I think we've got 9 or 10 medical examiners. We're really the constant in the office, the supportive role, dealing with referrals which come in, go through that referral, and then basically making sure that the certification's done correctly after scrutiny by the medical examiner, and then goes down to the registrars.
So how many medical examiners do we have at the moment?
We've got around about 9 or 10 medical examiners from various backgrounds. You've got to be a senior doctor for 5 years or more, but we've got a real good spread of experience. We've got doctors from the community, GPs, ED, paediatricians. So when we do have a complex death, or we've got certain types of deaths in, we've got a real good pull to pull on for those complex cases.
So Darren, you mentioned that you're hosted by ELHT, but my understanding is that the ME service is independent. Could you tell us a bit about that?
Yeah, of course. As you say, we are independent and hosted by the Trust, but we're not accountable to them, nor any other trust which we will come into contact with or any other stakeholders. The only people we are accountable to is the National ME Service, the Regional ME Service, and of course, any relation to coronal deaths, we report to the coroner.
Thanks, Darren. Could you tell us a little bit about the referral process that GPs will have to go through to refer into the ME process?
Of course. Going forward, the referrals are going to be made via email. They're going to drop into our medical examiner's email box. Part of my role and what I do and my colleagues do is we'll build that case. So when the information comes in, there'll be a set process or set format which it comes in through, and we'll go over that at the end of this question with yourself. But we'll get a set amount of information from the GP. We'll look at that information and we'll build on that. It may be that we have to go back to the GP for some more information, or we look at further clinical records elsewhere. We prepare the case on a local system at the hospital, albeit that is independent and that is not looked at by any other trusts, etc. Once we've built that case, we put that forward to the ME. The ME looks at that. He or she will do the scrutiny, and then it'll be passed back to us to notify the GP. I think national guidelines state it takes about 3 days, but at the moment we aim for 24 hours Monday to Friday. In relation to that format coming in, do you want to expand on that, how it comes in from EMIS?
Yeah, so we worked on developing a template and a referral form, and we're going to develop a separate video showing GPs how to work through that system, and there is an SOP in place as well, which we'll share. So Andy, could you tell us a little bit about what governance processes there are in place for learning and the information sharing agreements in place?
Yeah, so there's national agreements with regards to data sharing that are going to be in place and will be law once it's passed through Parliament and statute. In terms of governance, the National Medical Examiner service and locally is in a unique role that we're reviewing all deaths. So we're going to gather a lot of information back. And I think it's really important to give that information back to the stakeholders and the users of the service. Certainly while we've been doing it in the Trust, we can report back any concerns, we can report back any incidents, any aspects of care that we feel could have been better or improved for learning purposes, and we provide a report back to the Trust. Going forward, as we roll out to community, we'd expect to do something similar. We'd be feeding back into the local governance processes that exist within GP practices and sharing that information. And actually, we're also sharing a lot of good comments and a lot of good feedback, which I think is really important as well for the clinicians and the teams involved.
So the medical examiner service won't have any kind of inquisitorial role into community deaths?
That's certainly not the purpose of it. Any concerns that are raised, the first port of call will be back to the users of that service through the existing governance processes that are in place.
So Andy, what challenges do you think we'll face in this community rollout?
Lots. We've worked really closely with yourself and other leaders in community to try and predict what they will be. We're well aware that GPs and clinicians are really busy and under a lot of pressure, so we've tried to develop this service to be as streamlined as possible, as efficient as possible, and actually to push the benefits of the service to clinicians. And there are lots. We're speaking to families, we're ensuring the accuracy of their MCCD so things aren't getting rejected by the registrar. Timing is going to be difficult. Darren mentioned, I think already, that we're aiming to get the information back to the GPs within 24 hours to try and enhance that process and push things through quicker. I think going forward, there's lots we can do together to try and make things better. If GPs are able to link into the service around deaths that are expected, particularly those deaths that are expected either out of hours or over a weekend, the ME service will have a capacity to have those conversations and interactions with GPs earlier rather than later. We have a large faith population in our area, and already we've set up some out-of-hours weekend service for the ME service to help deal with faith deaths and give them some priority over that time period. But there will be challenges. We're not naive to that fact, but we've put a lot of work in developing this rollout, and we're very receptive to feedback to try and get it to work for the users of our service. That's what we're there for.
So what can GPs do to make this process as easy as possible?
They can engage with it, I think. We know this is more work, but the more the GPs engage, it is going to be law. And so we've tried to get the rollout in advance of it being statute, so we're in a good position, we're up and running with the service. When it's there, the earlier the GPs can refer the deaths in. There have been changes in law again with regards death certification process post-COVID. The law now states you have to have seen the patient within 28 days and treated for the same illness, or treated for that illness and seen them after death. So there are options for GPs to try and improve on that, whether that's video calling for patients, which is allowed, telephone consultation isn't. We're there to support the GPs in this process and the scrutiny of deaths. So the more they engage in it, the more they learn how to manage the system, which we've tried to streamline and make as user-friendly as possible, the better, I think. And we're not there imposing. This isn't an ME service that we're imposing on them. This is an ME service we've provided for the users, and it's for them to engage in it, and it's going to be a requirement, unfortunately, for them.
I hope that's been useful. Thanks for listening. If you feel there are any questions that haven't been answered and anything that you feel you still need us to sort of look at, then don't hesitate to contact us and we'll try and somehow answer those questions for you.